Hello everyone, I'm Autumn Lintz, the Education Manager at the Cutaneous Lymphoma Foundation. I'd like to thank you for joining our webinar today, Protecting Your Privacy. We are excited to have you here today and we're ready to get started. But before I introduce our speaker, I would like to go over some housekeeping issues. Thank you for attending. I will be the participating staff for the foundation. We will also have question and answers available using the Q&A tool in Zoom. So please feel free to add your questions throughout the webinar. We will be recording this webinar and the video will be available on the foundation's YouTube channel in a few days. We will also send a link via email to all who has registered as a thank you follow-up. We would like to thank our individual donors and our funding partners for making programs like this possible. We cannot do it without your donations and our funders. This is how we exist, and this is how we are able to produce patient education forums, webinars, publications, and other education materials. So thank you for your donations. Upon conclusion, there will be a survey that pops up on your screen as you exit. We would appreciate you taking the time to complete the survey. We do use the feedback to guide future programs and to ensure we are meeting the needs of the community. So please take the time to complete this survey. If you are not already on our mailing list, please join. Visit our website for any educational information, join our community connections for peer-to-peer opportunities, and always follow us on social media to keep updated. Now I'd like to introduce you to our speaker. Please welcome Monica Bryant with Triage Cancer. Thank you for joining us today, Monica.
Thank you so much for having me. I am delighted to be here.
So Monica is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on healthcare-related issues. She is the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization. Ms. Bryant is co-author of the first and only book of cancer rights law, which was published by the American Bar Association in 2018. She regularly shares her expertise through written book chapters, articles, and blogs, and appears on television, radio, and podcasts. She is a member of the American Bar Association's Cancer Legal Advocacy Task Force and Affordable Care Act Task Force, the Coalition to Protect Parenthood After Cancer, the National Cancer Legal Service Network, and many other legal and cancer community initiatives. We are very lucky to have her and all of her expertise here with us today.
Thank you so much, Adam. Autumn, I'm delighted to be here to talk a little bit about privacy. And because we only have an hour together today, I just wanted to briefly talk a little bit about the resources that Triage Cancer has, so that if after today you have questions about privacy and disclosure, or any other cancer-related legal issues like employment rights or health insurance or estate planning, you know that in addition to Cutaneous Lymphoma Foundation, Triage Cancer can be a resource to you as well. All of the resources that we provide are provided to the community completely free of charge and include events, animated videos, online resources, downloadable and printable resources, recorded webinars, and I'll point to some of these resources for you throughout today's webinar. There is also going to be a resource list with clickable links, so don't feel like you have to write down all of the links that you'll see on my slides. Now, even though we have tons of resources to provide to you on our website, we know that sometimes you just need to speak to a real life person. And so for those instances, we also have what's called the Legal and Financial Navigation Program. And this is where you can fill out a form on our website, tell us a little bit about what's going on, what your questions are, and then schedule a meeting with one of our expert staff. We don't provide legal representation, we don't provide financial assistance, but what we do is explain the law, explain your options, and try to help you with understanding what the pros and cons are of those various options. So please know that that's a resource for you as well. But to get to the heart of the topic today, I'd like to introduce you to Carol and Diana. Carol was 24 when she was diagnosed with cancer. While she lives in a big city, she felt isolated that she didn't know very many people her age with cancer. She also didn't really feel comfortable sharing a lot of details about her diagnosis and the side effects she was experiencing outside of her immediate family. Carol met Diana in a closed cancer support group on Facebook. Diana was 26 when she was diagnosed and had been very open about her diagnosis, even starting a publicly accessible blog to document her experience. About 6 months after meeting, Diana wrote about her friendship with Carol in her blog and tagged her in social media. This is a very common scenario, and we're going to sort of talk through all of the places where disclosure matters and where there are opportunities to make conscious disclosure decisions. Now, why do we spend time talking about disclosure? There's a lot of reasons. I think first and foremost, it is a personal decision. And after a cancer diagnosis, we know that it can often feel like you've lost a lot of control over what's going on. And making conscious disclosure decisions is one place where someone can take back a little bit of that control. We also know that disclosing can have a wide impact. So certainly it can have an impact in the employment context, which we'll talk about today. It can also have an impact within relationships, be it friendships or family or even romantic relationships. We know that it can also have an impact when we're talking about certain government or private benefits you might be entitled to, like disability insurance. And then unfortunately, we know that there is a lot of situations where inadvertent or accidental disclosure happens. And sometimes that's because people didn't even know that they had choices to make around disclosure and maintaining their privacy. So none of this is to say that there is one right answer. In fact, most people don't fit into one box when it comes to disclosure decisions. But what I want today to be is a starting point for you all to think about how you feel about disclosure and where there are places where you can make decisions. And then also, of course, what's legally required or not. We often think that disclosure is a spectrum. It may not be linear. So there are some people who are a closed book. They don't want to share anything with anybody except their healthcare team. Or maybe you're in the boat where, okay, your family knows, but you're really not talking about it outside of that. Certainly, it could be a situation where close friends know what's going on with you. Maybe it's, only your immediate family. Maybe you're starting to talk to it with people that you're dating, but only after a certain number of dates. Sometimes there's going to be decisions around disclosure in the employment context. So are you talking about it widely, or maybe only to HR, or only to your supervisor, or maybe only to your closest friend at work? And then there's the open books, the people who are blogging, who are putting it out there on social media, who are literally shouting it from the rooftops. And again, none of this is what's right or what's wrong. It's just about where you feel comfortable. We also know that disclosure decisions may change over time. So even if somebody started over on the right and they're that open book, as time goes on, they might want to start dialing it back a little bit. Maybe they don't want to be talking about it on social media all the time. And there's lots of reasons for that. Certainly, it's hard to put the cat back in the bag once you have disclosed, but there are ways, again, to sort of dial back and to not make it the first thing that people want to talk to you about. We also know that for some people, after their initial diagnosis and kind of getting through active treatment, maybe they're more willing to talk a little bit more about it. So it really can change over time. Now, when we talk about disclosing to your family and friends, there are certainly some benefits. These are people who love you. They know you pre-cancer. They are a consistent force in your life. They can be a support system, both emotionally and those more tangible support things that might need to happen, helping with meals and scheduling. It could also be that they are your escape or your distraction. So telling your closest girlfriends, because you guys have margarita night every Friday and you want to make sure that keeps happening, but you're not drinking anymore, but this is why. So it might be that you want to disclose to both family and friends. Maybe you're only going to talk about it with friends. This really, again, is going to be very personal to your own situation. One of the misconceptions that we hear from people is that they feel like if they aren't disclosing everything about what's going on with them, that somehow they aren't being honest or authentic. But the reality is we have many versions of ourselves, and we don't always show all of those versions in every circumstance. Think about it this way. How you might behave at a family game night isn't how you're going to behave necessarily during a staff meeting with your employer, right? You have different versions of yourself based on the people around you and the circumstances that you're in. The same can be true when thinking through disclosure, in that you can have different versions of what you choose to talk about with your family and friends versus your employer. The reason we talk about this is that we hear from a lot of people sort of that, I wish I had known. I wish I had known that I had choices to make before I told everybody. I didn't know I had a choice to be made. So we try to talk about it with as many groups as possible so that they can feel like they have all the information and can make educated decisions. We also hear from some people that they disclose because they feel like they need to get the kind of support that they need. And there are opportunities to get support online even that are more locked down and more controlled and more private. My Lifeline is a great example of that. There are privacy settings. It is Caring Bridge is another one where you sort of invite people into your space, and it's only those people that have access to the information that you share, versus something like Facebook or Twitter, which are very open, even if you have higher privacy settings. Another place where we see people sort of feel like they have to disclose if they want to engage is in advocacy. Now, I spend a lot of time as a cancer rights attorney talking about advocacy, and it really is at the core of what Triage Cancer is about. What is it? Well, it's about really applying pressure and influence on the people or the institutions that have the power to give you what you want. And that could take many forms. This is what we call our spectrum of advocacy. And there are people who are only engaging on one or two levels of this spectrum. You know, if you are here today learning about what your options are, you're engaging in personal advocacy. But then there are some people who want to be more involved and want to sort of shepherd in change. So they may want to be engaging in scientific advocacy. Certainly, if you complete the survey that Autumn referenced at the end of this webinar, that is in fact engaging in scientific advocacy because you are trying to make a program better. Another place that we see people engaging in advocacy, particularly in the cancer community, is in organizational advocacy. So if you have ever shared information with others about Cutaneous Lymphoma Foundation, if you have ever done a walk or a fundraiser for an organization, you've engaged in organizational advocacy. And what can be a little bit tricky about engaging in organizational advocacy is you may feel like in order to do so, in order to be effective and authentic, you have to share your experience with cancer. And that's not necessarily true. I myself have never been diagnosed with cancer, and I spend all my time talking about triage cancer and cancer rights and cancer advocacy. And so taking it out of what you think people think about you, and really recognizing that there's lots of reasons why somebody might be engaged in organizational advocacy that don't have anything to do with a personal diagnosis. You may also feel like you want to engage in media advocacy. And this is something that I think a lot of people find very daunting, that, you have to be some sort of expert in a topic or be willing to be interviewed on the news. But media advocacy could be writing a letter to the editor if something comes out about cancer research funding being cut and you want to express your opposition to that. Again, you can do that without talking about your personal diagnosis. So you've been impacted, you've seen others, you see the toll that cancer is taking on your community, and here's why you want to be engaged. Another way to engage in media advocacy is, in fact, using social media. And I know I just talked about social media being a place where there is sometimes that accidental disclosure or a place that isn't private. But you can engage in social media as a form of advocacy, again, but not talking about your personal experience. So raising awareness, raising issues, retweeting research articles or great resources that you found. To be perfectly honest, most of what we talk about at Triage Cancer isn't specific to cancer. It's really information that we all should know and we all should understand about our health insurance and our employment rights. We just talk about it through the lens of cancer. So there are times when someone may ask me a question on social media about how to pick a health insurance option, and I might share a video from Triage Cancer and just say, ignore the cancer part. This is applicable to anybody. And the same could be true for many different resources. Using social media is also a really fantastic way to engage with elected officials. More and more elected officials are engaging with their constituents on social media, whether it's Twitter or Facebook or even Instagram. And the feedback that we're getting is that people actually are getting more personalized, authentic responses from elected officials than they would if they were to write them a formal letter and get that form response back. So if you're interested in engaging with your elected officials on social media, you can find the federal members of Congress, all of their Twitter and Facebook handles on our website under the advocacy page. We also have a great archived webinar that we did with Living Beyond Breast Cancer on how to use Twitter as an advocacy tool. And so that archived webinar is available on our website. And why would you engage with your elected officials? Well, it's to engage in legislative advocacy. And to be perfectly honest, the reason that we have so much to talk about at Triage Cancer and so many laws and programs and benefits that you're entitled to is because people engaged in legislative advocacy. And this is where you're trying to achieve some sort of legislative outcome, additional funding for cancer research, a change in the definition of family for the Family and Medical Leave Act, advocating for paid leave, since we really don't have that in this country. There are all sorts of things that need to occur to improve the quality of life for cancer survivors that can be achieved by engaging in legislative advocacy. This, again, is something that some people find sort of daunting and scary and overwhelming, but it really doesn't have to be. Tweeting to your elected official for them to please consider taking a look at a blog that lays out an issue, or even just calling them on the phone and asking them to support a particular bill. There are so many organizations, both within the cancer community and within the healthcare community at large, that have organizational advocacy efforts. So you don't have to do it all on your own. Engaging with perhaps the American Cancer Society's Cancer Action Network, where they will kind of send out alerts of like, hey, this is going on, click here to contact your elected official. And there are literally so many, I don't want to say hundreds, but probably close in the cancer community of these types of advocacy efforts. Some are specific to a type of cancer, some are specific to a population, like caregivers, for example. And you could certainly join more than one. You can find all of those on the advocacy page of our website if you're sort of interested in learning more about what's there. But the easiest thing, and perhaps the most important thing that you can do to engage in legislative advocacy also happens to be the most private thing, which is voting. I guarantee you voting is 100% more effective than just complaining on the internet. We're so lucky in this country to have a say in who our elected officials are that when we're frustrated about the lack of programs or the complicated rules for various programs, the way to change those things, the way to improve those systems is to potentially change our elected officials. And one place where we see that happening on a pretty regular basis is with respect to Medicaid expansion. There are some states that have continued to resist expanding their Medicaid programs, which means that there's about 3 to 5 million people who would have had access to health care that don't because of that. And when people call us from those states and are frustrated about that, what we have to share with them is the only way to change that is to engage in legislative advocacy and vote. Now, I want to switch gears a little bit to another very common area where we get questions around disclosure, and that's work. There are a lot of considerations to make when it comes to deciding what you are or aren't going to disclose at work. And it could be about wanting to just maintain privacy overall. It could be about not wanting to be seen as the person with cancer at work. We hear from a lot of people that they don't want to disclose at work because work is the place where they can just be. They don't have to be the person with cancer, or they don't have to always be thinking about their cancer. It's that place that they're normal. There's more normalcy at work. For some people, they feel like they're going to be treated differently, or there's potential for discrimination if they disclose. But then on the flip side, there's a lot of times people are concerned that if they don't disclose and somehow it's found out, that they're going to be negatively impacted. Or that if they don't disclose, they won't have access to certain benefits and protections, like medical leave or reasonable accommodations. So when you're thinking through if you want to disclose or not, it is helpful to kind of think about the relationship piece. So will disclosing impact the relationship that you have, or not disclosing impact the relationship? There may be situations where you have visible changes that may spark questions. And if you're choosing not to disclose, how do you explain those visible changes in an authentic, understandable way? Certainly, I think it is helpful to know what your projection is with that employer. Like, do you plan on spending a long time with that employer? That may impact whether or not you choose to disclose or not. Similarly, if you're looking for a new job, thinking through what you want to disclose, how you want to disclose, and when you want to disclose are all really important things to be thinking about, not in that first interview. You've thought through them and you have a plan in place before you get to that first interview. Now, the good news is there are some pretty specific rules around what employers or potential employers are allowed to ask you. Prior to an offer of employment being made, so think in the job interview part of the employment process, employers or potential employers are really only allowed to ask 2 questions. Can you perform the essential functions of the job? And how would you perform the essential functions of the job? Now, that really speaks to the definition of being a qualified individual under a federal law called the Americans with Disabilities Act, or the ADA. And the ADA is the federal law that provides lots of protections and tools in the employment context for individuals with a disability. And in many situations, not all, but in many situations, a cancer diagnosis for this purpose is considered a disability under the ADA. So it's pretty limited. Can you perform the essential functions of the job, and how will you perform the essential functions of the job? Now, once an offer has been made, but before the job is actually started, employers are entitled to ask disability-related inquiries or ask a potential employee to take a medical exam. But those questions and that medical exam have to be required of all individuals of that job category. So they can't look at someone and go, you look a little sick. How about you go take a medical exam first before you start work? It has to be like, it's a standard, every nurse in this category takes a medical exam, or every bus driver has to take an eye exam. Now, if something comes up in that medical exam that an employer could potentially wonder if you could complete the essential functions of the job, they have to give you the opportunity to respond and explain how you would perform the essential functions of the job. Once you've started working, employers can only make medical inquiries or require a medical exam if it is job related and consistent with business necessity. So those inquiries or that exam has to be related to the job. It might be perfectly reasonable for a school district to require that everyone who's going to drive a bus take an annual eye exam to make sure that they can safely drive children. Perhaps it's about firefighters having to take a physical fitness test to make sure that they can perform their duties with all the gear they have to wear. It's related to the job and business necessity. Now, one of the things around disclosure at work is that there are some benefits you might be entitled to, like medical leave under the FMLA or a similar state leave law, or something called a reasonable accommodation under the Americans with Disabilities Act or a state fair employment law. And a reasonable accommodation is, I think, one of the most important tools for someone who's trying to work through treatment, return to work after treatment, or even to take time off. And so, given that it's such a valuable tool, people want to make sure that they have access to it. And so then it comes up about, well, wait a minute, if I want to take time off or if I want to access reasonable accommodations, what do I have to share about my diagnosis? And the answer is, generally, you're not required to share your cancer diagnosis, but you will have to share some information about your medical condition in order to use those protections and benefits. Now, this is sort of detailed and nuanced, so I do want to just mention we have a quick guide for employees, specifically thinking through disclosure and privacy. We also have one that's geared more towards healthcare professionals to help their patients work through these decisions. Now, when somebody asks for a reasonable accommodation at work or asks for medical leave, employers are entitled to ask that employee to have a medical certification form completed by their healthcare provider. And that medical certification form could be something that the employer creates themselves. But the thing about it is, they may ask questions that they're not necessarily entitled to, like diagnosis. And so the message here is that if you are asked by your employer to get a medical certification form completed and you hand that to your healthcare professional, make sure to have a conversation with that healthcare professional about what you are or aren't disclosing at work. So how does somebody complete a form trying to take time off if they have a cancer diagnosis but maintain that privacy? The reality is, typically when people are trying to access a reasonable accommodation or access medical leave, it's because they're dealing with a side effect of treatment, not necessarily the cancer itself. And so having that conversation with the healthcare team and really digging down as to what is the need for leave or what is the need for the reasonable accommodation, and then speaking to that on that medical certification form. So somebody's dealing with extreme fatigue as a result, a side effect of cancer treatment. Well, you can speak to that extreme fatigue without ever mentioning the word cancer. There are lots of medical conditions that could lead to extreme fatigue or pain or nausea. So the point is to have that conversation with the healthcare team, because if you don't, most healthcare teams are going to see a line for diagnosis and they're going to say like, well, I work in the cancer center, I'm going to write down cancer. So having that conversation is really important. And we have this conversation with the healthcare providers as well when we do trainings for them, that they need to be initiating conversations with patients as well, that it really should be a two-way street. Now, remember how I mentioned that some employers will create their own forms and ask for things they're not entitled to? One workaround is to use the Department of Labor's model form for FMLA. There's two versions. There's one if someone is taking time off for their own serious medical condition, and then there's one if people are taking time off to act as a caregiver to a seriously ill child, parent, or spouse. And so the Department of Labor has these two forms. They're 4 pages long. It does not include a line for diagnosis. But it does include a place for the healthcare provider who is completing the form to list their type of practice or specialization. So again, if form gets handed to healthcare provider and healthcare provider never has a conversation, they're going to write down oncology social worker or oncologist. But we've had oncologists themselves tell us, oh, if I knew it was a problem, I would write down internist or internal medicine. Still 100% accurate and truthful, but just not over disclosing. Now, we also know that sometimes that isn't always going to be the workaround with Google or small towns. It's going to be very clear if a certain provider signs this form, what medical condition that you have is. The good news is the FMLA actually lists out all the different types of healthcare providers that can complete the medical certification forms. And as you can see, it's a pretty varied list. And so thinking down to what is the need for leave and what healthcare provider do I have that can speak to that need? If I'm dealing with depression, that's something perhaps a clinical psychologist could speak to. The oncologist doesn't need to talk about it. If I'm dealing with extreme anemia or fatigue, that's something perhaps a primary care physician can speak to. We don't need to have the oncologist talk to us or sign this form. So again, it's sort of thinking more broadly about who your healthcare team is made up of and who could speak to that thing that is causing the need for leave or the need for the reasonable accommodation. Now, if someone asks for reasonable accommodation or FMLA leave, there are definitely constraints on what an employer can and cannot do. So employers are not entitled to ask for medical records. So they can certainly ask for this medical certification form, but not all of your records. And any information that they do get, whether it's results of a medical exam the employer has asked for, whether it's a medical certification form, those things have to be kept in a separate, confidential employee file. They cannot be kept with regular employee records. And access to those medical files has to be limited. Employers also aren't entitled to contact healthcare professionals who have completed the medical certifications, except in kind of 2 limited instances. For individuals who have completed an FMLA form, employers can contact those providers to authenticate and clarify. Authenticate means, did you, healthcare professional, actually sign this, or did my employee forge it? And clarify means, I can't read what your handwriting says on line 3. Not something like, could you clarify what you mean by fatigue? That is not permissible. Now, for a reasonable accommodation under the ADA, it is less clear, but an employer cannot contact an employee's healthcare provider without the employee's permission. So that's another opportunity for the employee and the healthcare team to have a conversation about what is or isn't being disclosed. There are some instances when recertification might be necessary. So for example, you've asked for 3 weeks off of FMLA leave, but it turns out that recovery is taking a little bit longer and you need an additional 3 weeks. Because the original form only asked for the 3 weeks, the employer is entitled to ask you to recertify for that additional time off. It could also be if you're asking for extended leave, so you've used up your FMLA leave and now you're asking for additional leave as a reasonable accommodation. So now you're getting an ADA certification. Or it could be circumstances have changed. You asked for reasonable accommodation not to lift more than 5 pounds, and then your boss sees you out at the bowling alley over the weekend bowling with a 16-pound ball. That could be a circumstance change when perhaps you need to have a recertification. And then employers are entitled to ask you for a return to work certification to make sure you can do so safely. Now, even with sort of all of these constraints on employers and choices to be made, and even for people who have really thought through their disclosure decisions and acted very cautiously, we see places of unintentional or accidental disclosure. And these are just some examples. So certainly others sharing information. Remember the friend who tagged the other friend on social media? We see that happening with family members a lot. And it's usually from an incredibly lovely place. Yay, my best friend just finished treatment for cancer. Isn't she awesome? And now you've been outed. We also see it in the crowdfunding context. So crowdfunding, an example is GoFundMe, has become increasingly more popular as a way to help people deal with medical bills. But the problem is most of those crowdfunding sources are Googleable, and they require someone to sort of tell a story about why you're raising the money. And so making sure that certainly before you set up a fundraiser for someone, you understand their disclosure preferences, but that also you talk with anyone around you who's considering these crowdfunding platforms about your disclosure preferences. We also see it for people who are looking for new jobs. So many potential employers will conduct background or credit checks. And if you've suffered a decrease in your credit score due to medical debt, that might be something that you need to be prepared to talk about and how you're going to talk about it. We also have seen some extreme circumstances where people forget that their employers, in fact, own their work email, their work voicemails, their work computers. And in those situations, for someone who's really concerned about disclosure at work, it is wise to separate any information about your treatment or your medical condition from those accounts or devices. So don't get voicemails from your healthcare team on your work cell phone, or don't use your work email address to communicate with your healthcare team. Don't spend your lunchtime Googling latest cancer treatments. And it's not that we think employers are out there, sifting through employees' emails to look for this information, but we do know that there have been instances where other things, other sort of searches that employers do in these systems has accidentally disclosed for somebody. Now, I've spent a lot of time talking about how you can protect your privacy if that is your choice. But there are some times when it is to your benefit to be the open book, even if you've chosen to be private in all the other places. One of those is certainly with the disability insurance application, particularly if you're talking about the federal disability insurance programs through the Social Security Administration, because they use the highest standard of disability that we have. And so talking about all the things that you're going through and experiencing and really laying them all out is going to be important to access a successful disability application. Also, communicating with your healthcare team. That is not the time to hide the ball or try to be private or minimize things. We know how many people in the cancer community underreport side effects and other symptoms that they're experiencing, but then also other concerns. Are you worried about how you're going to make it through work? Are you worried about your financial health due to the cost of treatment? Are you worried about your loved one who seems to be depressed because of your diagnoses? Those are all the kinds of things that should be talked about openly and frequently with your healthcare team. And then certainly if you are experiencing any of the psychosocial challenges like anxiety or depression or worry or stress, please do not keep those private. Just find the right person to talk to them about. And sometimes that right person is going to be a mental health care professional. And I think that this is a real challenge when it comes to cancer care, and there are huge disparities with respect to access, but there are definitely lots of places that you can go to seek out mental health care, and we've included links to some of those places in the resource document, and you can also find them on the Triage Cancer website under stress management. So before I turn it back over to Autumn for questions, I just want to highlight 3 specific resources related to disclosure. The first is that quick guide I've already mentioned, which lays out a lot of what I've talked about today. And that can be really helpful if you're trying to sort of talk to others about your disclosure choices. We also have an hour-long recorded webinar with myself and one of our most favorite partners, a licensed clinical social worker, Julie Larson, where we talk about not just the practical pieces around disclosing, but those sort of emotional and psychosocial pieces as well. And that's available recorded on our website. And then for those people who aren't interested in a full hour, but just want the gist of it, we have an animated video that's about 5 minutes long on privacy choices after a cancer diagnosis. So while I certainly hope that this is not the end of your relationship with Triage Cancer, I am happy to answer the questions that you have today. So I'll turn it back over to Autumn.
Thank you so much, Monica. That was a lot of wonderful information, and you actually answered some of the questions that we had with your presentation. So I have shifted them around a little bit, but we do have a handful of questions for you, so we should go ahead and get started. So the first question we have is, if I am diagnosed with cancer when already working for the company, will my insurance company tell them?
They shouldn't. So even if the company is what's called self-funded, which means that the employer is paying directly for the employee's healthcare costs, there is supposed to sort of be a wall between that medical information and the employer themselves.
Okay, thank you. That's good to know. Our next question is, my treatment requires 2 appointments a week, 2 hours each time during the day. Should I disclose my diagnosis to assist in obtaining the time off?
So should is going to be up to you and your circumstances and how you feel about disclosing at work. Disclosing the exact diagnosis and the type of treatment is not required in order to access certain legal protections. But I would want to know things like, how big is the employer and what state is the employer in and how long have you worked there? Because all of those things are going to determine whether you have access to reasonable accommodations, either under the ADA or the state fair employment law or the FMLA.
Okay, that's good to know, especially about it being different by state, because everyone is a little bit different.
Yeah.
What if my employer is changing health insurance providers and my doctor is not in the new plan's network? How can they accommodate me so that I can stay with this doctor?
So that's a really tricky one. You have a couple of options. So the first is you could potentially see what options are available for you in your state health insurance marketplace, otherwise known as Obamacare. So people don't realize sometimes that we aren't required to take our employer's health insurance. We could go purchase our own. The other thing potentially is you could negotiate with the provider to see if they're willing to charge you in-network rates. You could also potentially appeal with the insurance company to see if they're willing to treat that out-of-network provider as in-network due to your circumstances. But it is definitely a tricky one, and there isn't one solution when those plan networks change.
It's really interesting. I never would have thought to try and negotiate with my healthcare provider to get the rates that the insurance company gets, because sometimes it's a pretty significant reduction. So that's a great piece of information. Our next question is, what if my employer learns about my cancer diagnosis from someone else? How do I handle it?
Again, another really tricky one, and one of those places where communicating your disclosure decisions to anyone that you choose to disclose to is really important. So if you choose to talk about it with a coworker, but you don't plan on telling your boss, making sure that coworker knows you're not sharing it outside of that, one-on-one relationship. But once the cat's out of the bag, really, an employer should know that they shouldn't be asking you about your medical conditions or any sort of medical information unless, again, it is, job related and consistent with business necessity. But if it's just somebody who's like, I heard you had cancer, what's going on with you? That's really not permitted by an employer. But that answer doesn't really answer your question, right? Your response probably isn't going to be, you shouldn't ask me that. So how do you handle it? I think there are lots of different ways. So it could potentially be something like, whatever's true for you. Yes, but I really prefer not to talk about it here, as work is the place where I really just get to focus on me as an employee. But we generally suggest, though, that people kind of practice whatever answer it is that they're going to give, and that they have a way to get out of the conversation being around your medical condition. And so it means that you have to actually shift the conversation mid-response. So something to the effect of, thanks so much for asking. I'm doing well, but I'd really prefer not to talk about it at work because I like to focus on being an employee here. And actually, while I have you, could we talk about our next quarterly review? I'm super excited about sharing all the things that I've been doing with you lately. And so it's about kind of twisting the conversation around so that now you're back to talking about work and not about your health situation. Because the reality is people ask even though they aren't supposed to.
I like the idea of practicing what to say, because especially if you're shocked by them asking, having something in your back pocket could really help you get through that.
And I think I'm sorry, Autumn, but one other point on that is that I think it's true for if you are already employed, but it's also true if you're going into a job interview. So just because I said employers shouldn't be asking those questions doesn't mean they won't. And so understanding how you're going to answer a question about your cancer is really important. Also, if you've had any physical changes, lost hair, for example, people are probably going to ask you about that. And so knowing what you're going to say ahead of time, if that happens, can be very helpful and can help reduce the anxiety and stress and trauma about having to have that conversation.
Yep, that's great. We are starting to get close to our hour, so we're going to just do 2 more questions, and then we'll do our wrap up. So what should I do if my employer has started treating me unfairly because I sometimes need to take time off due to my cancer?
Well, I would want to know more information, to be perfectly honest. So how are you taking that time off? Is it job protected leave under the FMLA? Is it a reasonable accommodation under the ADA? Because those are really going to define sort of what rights you have. I would say certainly documenting everything that's going on is going to be very important for you. And then I think depending on what you've disclosed or haven't disclosed, having a conversation with the employer so that you all are on the same page. If you haven't already asked for reasonable accommodations, maybe you should, because that puts you into a sort of protected class, because those are going to be the things that sort of take it out of, oh, I'm just taking another day off, to I'm legally entitled to this time due to my disability.
Okay. Yeah, I understand that a lot of times there's a kind of a little bit of a, do they know about your diagnosis? Do they not know about your diagnosis? So that can make it challenging for you to answer, but hopefully your answers are going to prompt them to look into it a little bit more. Okay, so here we are going to have our last question, and it's a little bit of a switch, is if I join a social media support group, am I better off not sharing details about my personal situation and condition?
Again, that's excuse me, a very personal decision to make. I know that there are people in the cancer community who could not sit with themselves if they weren't as open as humanly possible about their experience. I know some people that wouldn't dream of telling anybody, and then I know a lot of people are somewhere in between. What I would say generally is, if you are in a situation where you could be looking for a new job at some time soon, or you perhaps are dating, or there are certain groups of people in your life that you wouldn't want to know what's going on, then being very careful what you share in an online support group. I think I once heard a great rule of thumb that if it's something that you wouldn't put on the front page of the New York Times, don't put it on social media.
Yep, it's great, because I think people forget, once it's out on social media, it lives forever, and it can come back around anytime. So what I wanted to do for our our last question is there anything else that you would like to add? You shared a lot of great information, and I wanted to see if there was anything additional you'd like to add before we wrap up.
I think just that, I hope I've made the point that this is not a one-size-fits-all decision, and that really wherever you land is okay. And that certainly if you have questions with more specifics, and if you didn't feel comfortable sharing or asking your question today, which I can appreciate given that it is a public webinar on privacy, please do feel free to reach out. That we have that intake form on our website, and that everything you talk to Triage Cancer about is confidential, and we are here to be helpful for you.
Wonderful. Well, I want to thank you again for presenting all this information. It was wonderful to share with everyone, and I want to thank everyone for attending, and we look forward to seeing you at future programs. Thank you so much.